Welcome back friends, again this MCQ series video. I am going to share 40 MCQs in this video. If you missed the first 3 parts, you can watch that in MCQs playlist. Otherwise, I will keep the links in the card of this video. These MCQs are really very helpful for prometric exams, and I got 100 MCQs more also. So total there will be 200 MCQs. That also I will share you as soon as possible, because someone told that they have exam in the last week of May, so I want to complete the MCQs. So we will start. Question number 61. Which reagent is used in oxidase test? Options are hydrogen peroxide, acetyl methyl carbinol, para-dimethyl aminobenzaldehyde, and last one is tetramethyl p-phenylenediamine diamine. And the correct answer is option number 4. Tetramethyl p-phenylenediamine diamine is the reagent used in oxidase test. Question number 62. Which of the following is included in the functions of neutrophils? Options are granule circulation. Next option is antibodies reaction. Third option is diapetesis is for chemotaxis. And last option is immunoglobulin production. And the correct answer is granule circulation. Granule circulation is included in the function of neutrophils. Question number 63. Which of the following viruses is classified as paramyxovirus? Options are mumps, H5N1, rhinovirus, and last one is influenza C virus. And the correct answer is first option, mumps. Mumps virus is classified as paramyxovirus. Question number 64. A blood donor comes to the blood donation center. He says he wishes to donate blood. An examination of both arms, there were skin lesions. What is the next step to be taken? Option deferral donor. Next option is collect blood from donor. Third option is ask donor to return from donation after 2 weeks. And last option is send donor to blood bank physician for evaluation. And the correct answer is that ask donor to return from donation after 2 weeks. Question number 65. Which of the following parasite is a significant intestinal protozoa to human health? Options are, first option is Entamoeba histolytica, next option is Ascaris lumbricoid, third option is Fascicola hepatica, and last option is Taenia saginata. And the correct answer is first answer, Entamoeba histolytica. A patient with deep subcutaneous tissue was admitted and diagnosed with necrotizing facilities. Her lab results shown organism gram-positive cocci, hemolysis shown beta hemolysis, and catalase test is negative. Which of the following is most likely organism? Options are Streptococcus pneumoniae, Staphylococcus liquidinensis, third option is Streptococcus pyogenes, and last option is Viridans streptococcus. And the correct answer is third option, Streptococcus pyogenes is the most likely organism. Question number 67. Which of the following is an example of selective media? Options are nutrient agar, nutrient broth, blood agar, XLD agar. XLD means xylose lysine deoxycholate. And the last option is the correct answer, XLD agar. XLD agar is the option of selective media. Question number 68. Which of the amino acid produces vasodilator on decarboxylation? Options are glutamic acid, histidine, ornithine, cytidine. And the correct answer is histidine. Histidine is the amino acid that produces vasodilator on decarboxylation. Question number 69. Which of the following fraction of bilirubin is water soluble and reacts with diazo reagent without adding an accelerator? Options are unconjugated, conjugated, total, indirect. And the correct answer is unconjugated bilirubin. Unconjugated bilirubin is water soluble and reacts with diazo reagent without adding an accelerator. Question number 70. In a sandwich reaction with an ELISA, which of the following is attached to solid phase? Options are patient antigen, next option is patient antibodies, third option is specific antigens, and last option is specific antibodies. The correct answer is last option. Specific antibodies will be attached to solid phase in sandwich reaction with an ELISA. Question number 71. Which of the following indicates standard PCR steps? Options are: first option is denaturation, annealing, and ligation. Next option is denaturation and annealing. Third option is annealing and ligation. And fourth option is denaturation, annealing, and extension. And the correct answer is last option: denaturation, annealing, and extension. Question number 72. The sickle test depend on which of the following? Options are: first option RBC count, next option is solubility of HbS, third option is reticulocyte count, and last option is hemoglobin concentration of the patient. And the correct answer is that sickle test depend on the solubility of hemoglobin S. Question number 73. A 30-year-old female comes to the emergency department with tiredness, headache, and weakness. A blood sample was taken from the arm with an IV infusion. What is the main cause of low result? Options: first option is unmixed samples, next option is clotted sample, third option is diluted sample, and fourth option is old sample. And the correct answer is third option: diluted sample is the main cause of low results. Question number 74. Which of the following technique is commonly used for hormonal estimations? First option is microscopy, next option is electrophoresis, third option is flame photometry, last option is immune diffusion. And the correct answer is immune diffusion is the technique that is commonly used for the hormonal estimation. Question number 75. What is the color of the label sample of hepatitis C patient? Options are red color, green color, yellow color, and orange color. And the correct answer is red color label sample of hepatitis C patient. Question number 76. Which of the following is resistant to penicillin? Options are cyanobacteria, next option is mycoplasmas, third option is spirochetes, and last option is vibrios. And the correct answer is second option: mycoplasma is resistant to penicillin. Question number 77. What is the specific stain for DNA zone in electrophoresis? Options are: first option is Ponceau, sorry if I pronounce wrong, Ponceau. Next option is amino black. Third option is ethidium bromide, and last option is Kumasi brilliant blue. And the third option is easy to pronounce, that is ethidium bromide is the specific stain for DNA zone in electrophoresis. Question number 78. Which of the following phase is the most problematic in a laboratory test? Options are analytical phase, pre-analytical phase, post-analytical phase, extra-analytical phase. And the correct answer is the analytical phase is the most problematic in the laboratory test. Question number 79. What is the difference between plasma and serum? Options are: first option is fibrinogen, next option is transferrin, third option is turbid color, and last option is ceruloplasmin. And the correct answer is first option. Fibrinogen is the main difference between plasma and serum. In plasma, fibrinogen is present, and in serum, fibrinogen is absent. Question number 80. ABO type on patient gave the following reactions: anti-A B cells 4 plus 4 plus, anti-B negative, anti-AB 4 plus, A1 cells 1 plus. Options are A1, A2, AM, AX. Correct answer is the A2. Sorry, I. Question number 81. Which of the following the best laboratory test for neonatal primary hypothyroidism? Options are free T3, free T4, thyroid binding globulin, and last option is thyroid stimulating hormone. Last option is the correct answer. Thyroid stimulating hormone TSH is the best laboratory test for neonatal primary hypothyroidism. Question number 82. For inoculation or plating of bacteria on a agar plate, which of the following should be used? Options are A loop with handle, next option is A hand finger, third option is A pencil, and fourth option is A pen. And correct answer is A loop with handle. For inoculation or plating of bacteria we will use. Question number 83. A patient is experience glucoseuria, means glucose in urine. An excess of which hormone could the cause? Options are glucagon. Next option is calcitonin. Third option is somatostatin, and last option is antidiuretic hormones. And the correct answer is glucagon. Glucagon is the hormone which can cause the excess of glucose in the urine. Question number 84. Which of the following are gram negative motile rods that are characterized by gray spreading film of growth on agar plate? Options are Proteus vulgaris. Next option is Enterococcus faecalis. Third option is coli. And last option is Bacillus anthracis. And the correct answer is Proteus vulgaris. Proteus vulgaris is gram negative rod that can be characterized by gray spreading film of growth on the agar plates. Question number 85. Which of the following is true for Vibrios and Pseudomonas? Options are they are gram positive, they are non-motile, they are oxidase negative, they are non-lactose fermenters. And the correct answer is last option, and they are non-lactose fermenters. Vibrio and Pseudomonas. Vibrio and Pseudomonas are non-lactose fermenters. Question number 86. Which of the following health hazard is associated with ethylene oxide? Options are irritant, carcinogen, nephrotoxin, hepatotoxin. And the correct answer is irritant. The health hazard associated with ethylene oxide is irritant. Which is the compound of choice for fixation of blood films for hematological examinations? Options are acetone, propanol, methanol, acid alcohol. And the correct answer is acid alcohol is the compound for the choice of fixation of blood films for hematological examinations. Question number 88. Which of the following is the post-analytical error? Options are improper preparation of the patient, calibration, pipetting, and interpretation of the data. Correct answer is last option. Interpretation of data is the post-analytical error. Improper preparation of the patient will be pre-analytical error, calibration, and pipetting is the analytical error. So interpretation of data is the post-analytical error. Question number 89. What is the appropriate diagnostic test for HCV? Options are agglutination inhibition reaction. Next option is reverse passive agglutination. Third option is immunofluorescence. And last option is RIBA, RIBA. RIBA stands for Recombinant Immunoblot Assay, RIBA, that is appropriately used to diagnose the hepatitis C virus. Question number 90. What are the maximum number of hours that can be used to leave blood sample on the bench before centrifugation, means at room temperature? Options are 2 hours, 6 hours, 12 hours, 24 hours. So correct answer is 2 hours is the maximum number of hours that can be used to leave blood sample on the bench before centrifugation. Question number 91. Which of the following is the correct sequence to be followed when preparing a donor arm for blood collection? Options are: first option, select vein, apply tourniquet, clean with PVP, iodine, vein puncture. Vein puncture. And next option is select vein, apply tourniquet, vein puncture, clean with PVP iodine. Third option is select vein, clean with PVP iodine, apply tourniquet and vein puncture. The last option is select vein puncture, clean with PVP iodine, apply tourniquet. And the correct answer is first option, select vein, apply tourniquet, clean with PVP iodine and vein puncture. Question number 92. In a precipitation curve, which of the following exists in the protozone? Options are: first option, antibodies excess; next option, antigen excess; third option, insoluble antibodies; fourth option, equal amounts antigen and antibodies. And the correct answer is antibodies excess exist in the protozone. Question number 93. Some patient platelet clump in EDTA or satellite, making platelet count falsely low. How should this be correct? My options are: first option is mix the sample, next option is warm the sample, third option is do manual count, and last option is use sodium citrate tube. So correct answer is use sodium citrate tube. So if some patients platelet clump in EDTA or satellite or making platelet count falsely low, then repeat the sample by using the sodium citrate tube. Question number 94. Which of the following gel separates large DNA fragments? Options are agarose gel, next option is cellulose acetate sodium, third option is denaturing polysaccharidamide, and last option is dodecyl sulfate polyacrylamide. And the correct answer is agarose. Agarose gel separates large DNA fragments. Question number 95. How many pressing points of an automated pipette can be used to release the sample from the pipette? First option is 1, next option is 2, third option is 3, last option is 4. And the correct answer is 2. Two pressing points of an automated pipette can be used to release the sample from the pipette. Question number 96. What does a quality control sample check out? Options are standard, next option is reproducibility, third option is sample blank, and fourth option is reagent blank. So correct answer is standard. In quality control sample checkout, what we will do? Standard. Question number 97. Which of the following is falsely increased when clenching the first prior to vein puncture? Options are: first option sodium, next option chloride, third option potassium, fourth option is ionized calcium. And the correct answer is potassium. Potassium can be falsely increased when clenching the first prior to vein puncture. Next option is question number 98. Which is the most likely stain used to identify for malaria parasite? Options are gram stain, iodine stain, Giemsa stain, Leishmania stain. And the correct answer is Giemsa stain. Giemsa stain is the most commonly stain used to identify the malaria parasite. Question number 99. Which of the following organism appears in gram-stained film as chain? Options are gonococci, streptococci, staphylococci, meningococci. And the correct answer is streptococci. Organisms appeared in gram-stained films as chains. Question number 100, sorry. In a complement fixation test, incubation of a patient sera for 30 minutes is allowed to lyse complement of the patient sera. What is the temperature required in degrees centigrade for the incubation? First is 46, next option is 56, third option is 66, and last option is 76. Correct answer is 56. Second option, 56 temperature is required in degree centigrade for the incubation. So 100 MCQs are completed here. Next 100 MCQs I will try to make two parts, 50 and 50 MCQs. Please follow that MCQs. That MCQs are also very important and helpful to pass the prometric exam of any Gulf country. Thank you so much.